done that before. There we go. Otherwise, the replay won't last very long. Okay, so what is our agenda for the next 3 days? So we are going to be breaking it down. Today, we are focusing on breaking perimenopause down, deconstructing it. We're going to explore exactly what it is that's going on in general. Believe it or not, a lot of women still are confused whether or not they're even in perimenopause when they may suspect it based on their age, based on some symptoms. But again, what exactly is going on? Why do no two women have the same experience? Why is the experience so different for so many different women? And we're going to explore all of that. We're going to explore what your symptoms mean, how to use them to your benefit and to leverage them to help you focus on the path forward so that you can finally turn this very overwhelming, sometimes very confusing stage of our lives into something that is going to benefit you. And I want you to eventually, at the end of this 3 day challenge, have had a complete mental shift into how you view perimenopause, menopause, and the years beyond. Unfortunately, too many women come into this transition, myself included, when it started for me a couple of years ago. And we start to think that the best years must be behind us because symptoms seem to be coming fast and furious out of nowhere, but we'll talk all about that. A heads up for tomorrow. So tomorrow we will be focusing more on the mindset side of things. This is absolutely essential and often a part of any type of health improvement routine that gets missed out. We cannot miss out the importance of mindset when it comes to making lifelong health changes, because that's essentially what I'm going to be teaching you. That's essentially the approach that I take. It has to be an approach that is something you're going to embrace for the rest of your life. This is not, I don't do one quick fixes or one size fits all type solutions for people, because the body, in my opinion, certainly doesn't work that way. And we'll get more into that as well. So on day 2, we'll be focusing on mindset and how to get your mindset in the right place, not just in the beginning stages of wanting to venture into a health improvement but journey, but also to keep you on track forever and a day, especially when life throws you those curveballs. So we'll be getting into that tomorrow. Day 3, we will then be bringing it all together. We're going to get into the practical stuff. We're going to focus on the nutrition strategies, what the role of nutrition actually is in giving us some power back when it comes to being able to balance our hormones, rebalance and heal our health from the inside out, and why that is the approach that you should take if you want symptom relief long term. So we'll pull it all together. We will then be talking about the framework, the step-by-step framework that I use myself, the step-by-step framework that I work with my clients with directly. And I want you to walk away with some clarity, not only on what it is that's going on inside you, but how to then move forward with confidence and excitement that, you know what, this does not have to be a period of your life that is just going to weigh you down. It doesn't have to be viewed as something like the end of the best years. In fact, it's the beginning. And that's the mind shift that I want you to have over the next 3 days. So what is our mission overall? This is the mission for this 3 days. When I was putting together this challenge, I had to kind of work backwards. Initially, I thought, what is the outcome that I want to give you? What I'm hoping you will walk away from after 3 days with me? And essentially, I want to guide you out of the overwhelm. So break free from the fog of all the confusion to get you to a point where you have so much more clarity and understanding about what's going on, not just in general when we get to this point in our lives, but inside you, inside your body, and how to leverage your symptoms to make them work for you and your health improvement journey. You're going to break free from limiting beliefs that are probably holding you back without even realizing it, and empower you to regain control over your health so that you can bridge that gap between where you are now, which I'm guessing is probably not where you aspire to be. We're going to bridge that gap and get you there and completely open up a whole new way of thinking for you to live your best years beyond perimenopause. So how do we do this? We focus on a holistic approach. A registered holistic nutritionist, and that was an absolute specific choice when I decided to go into studying nutrition. I wanted to come at it from a preventative area versus a after the fact reactive, trying to help people who are already ill, which is typically the difference between a nutritionist and a dietitian. I get that question quite a lot. I believe that our body has the ability to heal itself and find its own natural equilibrium if we give it everything that it needs. We give it the building blocks. So we must focus on a holistic approach when we are looking to naturally rebalance our health and heal from the inside. So we're going to weave together the mindset shifts, nutritional insights, and healthy lifestyle habits so that you can heal and rebalance from the inside. That's the only way that you are going to see results that are maintainable long term and truly feel your best physically and mentally. Also, it's not about managing symptoms, it's about unveiling the underlying issues that are making your symptoms either more frequent or more severe than they need to be. Just because we're going through this inevitable natural hormone wackiness with our reproductive hormones, it does not mean that we should be completely falling apart. In fact, it's our habits that typically have gotten us to the point where we start to feel like we're losing control. I'm going to show you that that is actually not the case and you can take your power back. I'm just trying to figure out how to move this power bar, by the way, because it's in my way. I wonder if I can stick it up there. There we go. Okay, so today's specific agenda, we're going to focus on understanding midlife and your unique situation and how to really pick it apart and understand what's going on, how to be more symptom aware and use it to your advantage. We're going to talk about the domino effect of hormonal imbalance and how one imbalance leads to other imbalances, and you'll start to see why the estrogen progesterone shift is not the only thing that's at play. We're going to talk about why some women suffer and some women don't. And I think this is a question I get all the time. You know, a lot of women believe that they are destined to have a hard time with perimenopause and menopause if their mother did, or their grandmother did, or their sister did. And although genetics do play a part, it's not the big part. The other part that where we can really make a shift as to what our experience is going to be like is actually within our control. We're then going to look at how you can identify your unique health imbalances. This is going to be a real eye opener, I think, for a lot of you. And when you start to get clarity about what the bigger picture is that's causing your specific symptoms in the way that they are, it gives you that confidence and that excitement to realize, oh my gosh, so there is something I can do about this. I don't have to live this way. And we'll tie it all together today by introducing you to the 3 pillars of holistic health that you must address for hormone balance. You have 2 resources in your workbook. We'll talk about the pre-work and the other exercises in your workbook later on. But within your workbook, there are 2 links for today's activities, and we'll talk about where they come into play later. Just know that it's the hormone balance, imbalance, and root cause assessment that we're going to be looking at later, and your happy hormones habit tracker. So if you've already had a chance to look at those and download them when you got your workbook, then if you have any questions, please feel free to post them here in the group, and I'll address them while we're here live too. All right. So first and foremost, for those of you, whether you're going to be joining us live or on the replay, is this worth your time? So ask yourself these questions. If you are a woman between the age of 40 and 60, and I say that loosely because some women start their symptoms even in their mid 30s. So take that loosely, but typically in this age range, and you're looking to help navigate all the symptoms that you are experiencing, physical, emotional, and mental, and you believe that you may be going through the midlife transition right now, then absolutely you're going to benefit from what we have to talk about tonight. Women who want to support their body, a mind through the midlife transition by addressing their health overall. If you are one of these women who already has an inkling that there's a bigger picture here at play, that just addressing your symptoms either by taking, one individual synthetic hormone, for example, or medications or sleeping pills or anxiety meds or antidepressants, sleeping pills. You already are, if you're here, you probably already know that there is a better way, there is a just as effective way to get relief. And it's by doing it naturally, by addressing the underlying issues. So if this is something that appeals to you and for your own reasons, you would prefer to manage your perimenopause experience more naturally, and that can be for a number of reasons. And it's certainly not something that I judge, by the way. Let's just make that clear. If people are getting help and feeling better by taking hormone replacement therapy, then I 100% recommend that they do that. But what I do also recommend is that they have explored all other options that are within your control that are a natural way of doing things. You may decide that you don't need those hormone replacement therapies after all. But that is entirely a personal choice. Women who are ready to embrace these years instead of fear them and are ready to make new, healthy, hormone balancing habits, if you are one of these women, then again, you're going to benefit a lot over the next 3 days. You know that you're done with living in fear. You're done with feeling like your best years are behind you, looking in the mirror and not recognizing who you are and letting it really get you down and knock your confidence. You've decided that's it. I'm done. I want a way out of this and I am going to embrace this. I just need to know how. If you have this thought pattern right now, then 100% you are in the right place. So let's dig a little deeper. Let's take a look at symptoms that you might be experiencing right now. So these ones on the slide are the most common. So chances are these are symptoms that most or all of you are experiencing right now, whether it's you've been experiencing them for a while or they're new and you suspect that they might be related to hormonal changes. So weight gain, even though you might be making healthier choices or certainly trying to exercise, difficulty sleeping, especially staying asleep, that 2 to 4 a.m. window is plaguing you. Seems like there's something constantly going on between 2 and 4 that wakes you up. Are you experiencing more episodes of sadness? It doesn't have to be clinical depression. It can just feel that way. Or anxiety. Mainly morning anxiety starts to become more common with the hormonal changes and obviously mood swings and irritability. You might be more self-critical of yourself, very irritable, get rattled very easily, and your self-confidence is really starting to wane. Fatigue, exhaustion, loss of energy, motivation, lacking enjoyment in your life. These are all very common symptoms that start to plague us. Are you having difficulty making decisions, brain fog at play all more often than you care to admit? You're starting to doubt your own mental abilities, and as a result, you're struggling to concentrate. These are all cognitive issues that tend to pop up in relation to hormonal imbalance as well. You might be losing your sex drive and your libido, or if you are still having sex, you may find that it is more difficult. It might even be painful, uncontrollable hot flashes and night sweats. You may just be starting to have them, or they could just be getting worse. Unpredictable and often scary periods, which are either more painful, more infrequent, more heavier than normal typically, although for some women they can be all of a sudden extremely light. If you're one of the lucky women that once your transition starts, it happens relatively seamlessly, the good sign is that there's your underlying health is clearly in a good place. However, most women tend to go through a period before their periods get lighter or more scarce where they can get heavier and they can get to the point of hemorrhaging. This happened to me specifically, and it can be quite terrifying. because I know for me, all of a sudden out of nowhere, I was getting periods that were a lot longer, a lot heavier, and I was struggling to live my life around them because they were so heavy and so unpredictable. I eventually found out why, and we'll get to that. There is a specific condition that I was diagnosed with, which a lot of you might also be struggling with, may or may not know. So we're going to talk about that. Increasing joint and muscle pain seems to come out of nowhere. All of a sudden, you feel like you've aged 10 years overnight. Gut disturbances, whether that's heartburn, excessive gas and bloating, or maybe your bowel movements are changing. Typically constipation, but you could have diarrhea or a combination of both. These, sadly, are very common symptoms of perimenopause. So they probably seem they're probably ringing bells for a lot of you right now. But then there's this list. So this is a list of other, believe it or not, more common than you think symptoms, but they are not as talked about. They're not talked about as often. So these tend to be the ones that really start to confuse women, start to make them think there might be something bigger going on. They can't really tie it to perimenopause because it's not something that is out there in the mainstream as much as everything that we saw on the previous slide. So that's ringing in the ears, ringing in, or tinnitus, as the condition itself is called. But it almost sometimes feels like you can hear the ringing, or it might even feel like you've gone deaf in one ear. Your blood pressure and your cholesterol, you don't appear to be doing anything differently, but all of a sudden you go and have blood work done, and your cholesterol and blood pressure levels are starting to increase. You may find that you have a dry mouth, or your taste buds are changing, and your breath seems bad, body odor, there's changes, and that's related to hormonal imbalance a lot of the time as well. But again, we start to think, do we have a dental issue? Is there a bigger issue going on? Increasing headaches and migraines. This one's obviously very unnerving when we start to experience more headaches, certainly migraines, but again, very common. Skin irritations, rapidly aging skin. Specifically, when I say skin irritations, itchy skin. A lot of people notice that they have more allergic reactions. They seem to be more sensitive to things, whether it's itchiness, whether it's redness in the skin. And this is a result of increased histamine levels. And this can be a real problem, especially for women that may have gut issues that are also affected with high histamine levels. But that's another day. That's another topic and another masterclass. Thinning hair and nails. I think that one's probably actually more common than we realize. We do hear about that one a bit more often. Increased muscle tensions, not just the aches, the joint aches and the muscle aches, but actual increased muscle tension. You feel like things are locking up or clenching or trapping nerves more often. Frozen shoulder, which is an actual condition where your arm literally can lock in place, is actually quite common. And believe it or not, is related to can be related. There's always other reasons for a lot of symptoms, but it certainly becomes a little more predominant during the midlife transition for a lot of women. Tingling in the extremities, or what we call electric shocks, you may experience that a little more. A burning sensation in your mouth or on your tongue or around your lips doesn't need to last long. It's just something that you become aware of. Or gum problems, so bleeding of the gums or receding gums or very sensitive gums. These are all very common symptoms, just not probably as common as the ones we talked about before. So if you're experiencing any of these, just know that everything we're about to talk about from this point forward to help rebalance all the hormones that are affected as you go through your midlife transition, you can get relief in all of these areas. How does that sound? That's already got you excited. I'm sure it has. All right. So if you're feeling any of this plethora of symptoms, just know that you are not going crazy. They are all actually quite common symptoms of our natural hormone decline and then hormone imbalance overall. So the natural hormone decline for many women, that is when a lot of these symptoms may present themselves for the first time. Some women obviously have had hormonal imbalance issues a lot younger and may be struggling with diagnosed conditions like fibroids or endometriosis. they are struggling with hormonal imbalances as well, but for obviously a different reason than perimenopause. They're too young to be at that stage. But for most women without those issues in earlier life, these symptoms, not only do they seem to come on around the time of midlife, but they all seem to come on fast and furious all at once, which is why it's so overwhelming. Now, this little chart here just gives you an indication of just how fast things can change, but also the varying age range. So you can't really say that every woman is going to go through perimenopause at a specific time or start perimenopause, I should say. Going through it is a whole different story. Perimenopause could last a year, it could last 10 years, depending on the woman. The symptoms that you experience as a result of your estrogen and progesterone declining, they're the main shifts that are happening, the natural shifts that are happening. The symptoms are going to obviously vary by every woman. They're going to come on and at different times, and and the severity of them will be different too. But just know that the age range is actually quite wide, and every woman's experience will be slightly different. But when these estrogen and progesterone levels do start to decline, you'll notice here they don't just plummet. They fluctuate like crazy. So anywhere between late 30s to early 40s, they slowly start to decline, but they do it in a jumpy way. So they're kind of up, down, up, down. Then when you get to like the mid to late 40s, they really start to fluctuate. So if you've managed to get to this point without anything major, this might be when you start to really notice a lot of new symptoms. So what happens here is as you can see, the fluctuations are much wider. And we're going to talk about the gap between estrogen and progesterone and why that is something we need to be aware of and concerned about in the next few slides. So to clarify the phases of the midlife transition, typically early perimenopause could start in your late 30s to your early 40s. Late perimenopause, so the later stages of the transition stage are around your late 40s. Menopause itself is actually defined as when you have gone 12 months without a period. So even if you have had all these crazy symptoms, but you're still having a period, or you may have not had a period for 11 months and 20 days, and then all of a sudden you do have a period, you haven't quite hit menopause just yet. When you can say you have safely gone 12 months without a period, it is highly unlikely you're going to get another one. You have then hit menopause. And that typically, again, if there was an average, age 51, 52, but again, it's going to be slightly different for every woman, give or take either side. Postmenopause, of course, is the 50s and beyond. So now what we want to do is take a look at exactly what it is that's happening. So we know that estrogen and progesterone are starting their wacky decline. Also testosterone as well. We obviously don't have as high levels as men do, but we do have testosterone. And as those levels start to fluctuate, they also contribute to some of our symptoms in weird ways as well. But this is where a lot of the focus stays, is on certainly estrogen and progesterone. And so therefore, when women are desperate for help, understandably looking to finally get control of their weight, get rid of these hot flashes, sleep through the night finally, control these mood swings, all the common symptoms, they may look for hormone replacement therapy and focus predominantly on estrogen. I think there's more and more awareness now that we also should be focusing on progesterone as well. Typically, if you still have a womb, then you should be focusing on progesterone as well. So I think there's more and more awareness of that. But either way, the focus tends to be around the fact that it's these hormones that are doing the dirty work. Now, inevitably, they are declining. They are kind of, in some women, triggering the wacky roller coaster ride we then go on for the next so many years. But what is happening is that because these reproductive hormones are starting to fluctuate and decline, they then have an impact on other very important hormones in our body that have just as important processes that they are responsible for initiating and sending the messages back and forth between the glands, between the organs within the body to make sure those processes happen smoothly and keep our body in balance. So we need to remember that there's a lot more at play than just estrogen and progesterone. When the stress and the thyroid hormones are starting to become affected, we notice a whole bunch of other symptoms. We'll talk about what they are. We'll clarify that as we move through. So your stress hormones, we have adrenaline, norepinephrine, but cortisol is the one that everybody talks about because it is your fight or flight hormone. It's essentially supposed to kick in when our body is under stress of any form. It doesn't differentiate between physical or mental. We just secrete cortisol anytime our body senses that we're under stress because it's our body's natural way of helping kick all of our body systems into gear, into high gear, so that we can escape whatever the stressor is or what we perceive the stress to be. Thyroid hormones T3 and T4 as well, they will also be affected. It's important to note that anytime your adrenal glands that are responsible for your stress hormones are tired or overworked, that will automatically have a direct impact on your thyroid function and vice versa. So we do need to make sure that we're supporting them both at the same time. Our appetite hormones, they get impacted when the estrogen progesterone decline starts, specifically ghrelin and leptin. So these two are responsible for, when they're working properly, letting us know when we're full. And therefore we stop eating. We have control over our appetite. We lose control over our appetite when ghrelin and leptin are out of balance with each other. And again, the start of that could be the decline of estrogen and progesterone. Other hormones that are affected, insulin and glucagon. So they are opposing hormones that help control our blood sugar and have a role in our metabolism. Specific and adiponectin and growth hormone as well. Insulin's the one we hear a lot about because, and rightly so, because we need to be very well aware of how well our body regulates insulin because it has a lot to do with our energy levels. It has a lot to do with whether we can burn fat or whether we store fat. It has a lot to do with pretty much how your body responds to stress, never mind the fact that it can leave you prone to type 2 diabetes later in life, which is typically lifestyle acquired, not type 1, but type 2. So your insulin levels are impacted as estrogen and progesterone do start their wacky decline. Neurotransmitters, they're also affected. So we're talking about the happy hormones, as we call them, melatonin, serotonin, dopamine. So melatonin is typically the one that puts us to sleep, ideally should put us to sleep and keep us asleep until morning. And melatonin levels should drop when we see daylight. Serotonin is the happy hormone that most people know about. When we have plentiful levels of serotonin, our moods tend to be more stable. We just have a naturally more generally happy outlook on everything. And we make the majority of our serotonin in our gut. We'll talk a lot more about the gut role on day 3. But just know that if our gut is not in a pretty place, then making enough serotonin is going to be a problem. And without it, our moods and our anxiety levels will suffer. And dopamine is that hormone that we feel when we get a rush of excitement, something, that feeling of being productive or accomplishing something. That's dopamine. Anytime you are able to give yourself that feeling of satisfaction, that's the rush of dopamine. So all of these other hormones start to fluctuate. Sometimes they increase beyond where they should. Sometimes they decrease beyond where they should. And it can be a result of estrogen and progesterone decline, hands down, no question. However, what also happens is the symptoms that we get when those other hormones are starting to fall out of balance as well, they are made worse because we already have an imbalance within those hormones that we just talked about that has probably nothing to do with the fact that you have just now started estrogen and progesterone decline. So we'll talk a bit more about that in a second and what I mean by that. So just know that when we're talking hormones and we're talking balance or imbalance, it's the domino effect. Hormones don't work in solo. They typically, in a nice, harmoniously balanced body, work together and they support each other in delivering all the right messages at the right times to the right places to get our body working efficiently. But when reproductive hormones decline, it does affect the fragile balance of all those other hormones. And then we start to see the impact. The adrenal thyroid dysfunction starts to struggle. We become resistant to insulin, which puts our body in a fat storage mode and our metabolism slows. We can develop what's called gut dysbiosis, which is essentially an imbalance within our gut environment that leads to very poor digestion, incomplete and slow digestion. And that in turn brings a whole slew of problems and affects our liver's ability to do its job, which is multifaceted. Cardiovascular issues, as we start to lose estrogen and progesterone, our cardiovascular system doesn't have the level of protection that it once did. Osteoporosis and arthritis, same thing. Our bones, estrogen, good, healthy estrogen, the estrogen that starts to decline and gives us the hot flashes and some of the icky initial later symptoms, they are healthy estrogen has a preventative nature typically. When we're in our younger years, before it starts to decline, we have a level of protection throughout our entire body. And that is thanks to estrogen. It's not just responsible for our fertility. There's so many protective elements to it that we don't realize until we start to lose it. So we do become more prone to osteoporosis or arthritis. Our cognitive functions, again, same thing. It affects the myelin sheaths that surround nerve endings, even in the brain, and therefore we do, tend to feel those cognitive impairments a little more. Chronic inflammation, I'm going to keep underlining that word, inflammation. Chronic inflammation becomes more rampant, becomes more problematic as the reproductive hormones decline because of the impact it's also having on everything else, the stress on the body, which further increases inflammation. Just know that inflammation, when it's left to run rampant throughout your body and it's in a chronic level of high inflammation, it leads to a lot of serious long-term illnesses. So one of our goals, as well as achieving hormone balance, is to reduce and maintain low levels of systemic inflammation, the type of inflammation that is damaging to our body, that is toxic, not inflammation as in the response when you have an injury and all the white blood cells come rushing to the surface to heal that wound. That is our acute inflammation response, and that's healthy. We need that. It's the chronic inflammation that builds up within our body and basically suffocates our body, and it's very toxic. And that brings me to the last condition, estrogen dominance. So as estrogen levels decline, our healthy estrogen, so does progesterone. However, if there is a big gap between the two, leaving you more estrogen dominant than progesterone dominant, you are essentially in a toxic state and a whole other plethora of issues can happen. How do I know so much about estrogen dominance? This is the condition that I was diagnosed with at the beginning of my perimenopausal journey. I had all the symptoms, and to be honest, I already knew before I went and chose to get my hormones tested. I'm just one of those people that just needs to know, and I need to see it on paper. But I knew because all of the symptoms that I had of estrogen dominance were playing through me. And my life to that point, my lifestyle, my stress levels, they were setting me up for this condition. So what is it? Essentially, as I said, when your estrogen levels are still higher than your progesterone levels, you're in a state of estrogen dominance. And what that means is although your healthy estrogen is declining as well, along with progesterone, there is other types of estrogen, toxic estrogen, that can circulate within our body. When we have too high levels of toxic estrogen, the declining healthy estrogen and obviously the declining progesterone means that the gap between the two widens. So the larger the imbalance, the more toxic estrogen you have versus lower progesterone as it continues to decline, the more severe your symptoms are going to be. Irregular, heavy menstrual cycles to the point of hemorrhaging at times. And that's exactly what I was dealing with. It was absolutely terrifying. This is one of the telltale signs. Anxiety that seems completely out of nowhere, very out of your control, and probably something you never experienced before. Mood swings, again, very erratic, one day to the next, even sometimes out 1 hour to the next. And you have symptoms of inflammation. You are aching from head to toe. Just as an example, I mean, we all know that that's inflammation. We sometimes don't realize that other symptoms are inflammation as well, but certainly your joints that aches and pains. I was experiencing all of these and they came on almost instantaneously. That's what it felt like anyway. Why you need to be aware of this condition and do everything in your power to minimize it is because long-term estrogen dominance, that long-term chronic inflammation, that toxic state can cause female hormone related cancers and other estrogen dominant related illness. So there's so much we can do. Please know, otherwise I would be sitting here crying into my tea, because this is a condition that I've had to struggle with. But thankfully, I have been able to employ everything that I'm going to share with you from a nutrition, mindset, lifestyle perspective and be able to turn this ship around. And the last hormonal test that I had showed that that gap is very, very narrow now. So I have done a lot of work and it's certainly doable. So why do some women suffer and some women don't? Well, we've kind of touched on this, but essentially it comes down to two things. You've got to look at nature versus nurture. So yes, there is a nature aspect to why some women struggle through perimenopause, whereas others don't. And that would be genetics, age and stage of life, underlying medical conditions or medications. Obviously, they are typically things like if you have an underlying medical condition that may be part of your genetics or hereditary illness or just part of your makeup, maybe you've had an issue from birth, like type 1 diabetes, for example, or juvenile in your juvenile years. Genetics, obviously the age you're at, these are things you can't typically change. So to some degree, you are likely more prone to struggle if your genetics and any potential underlying condition you can't really do anything about other than control it. If they are in your family or you've already experienced them, then yes, you are more susceptible. But here's the thing, what we don't focus on enough is the nurture side, and it is actually the nurture side of how whether we suffer or whether we don't, that is the part where we have so much control and we can actually swing it into everything into our favor and outdo anything that nature may have had in store for us. So consider nurture like your triggers. So nature is the susceptibility that you have that this might be in your future because it's a kink in your DNA or just a condition you've had to deal with for many, many years, and it's only something that you can control, you can't get rid of. But if you focus on completely overhauling your nutrition habits in a specific way, and we'll talk about how, your lifestyle habits, you control your stress, you understand the importance of managing how quickly you can blunt that stress response when you feel it rising. If you focus on your sleep quality and making it a priority in your life and doing everything you can to ensure that you don't feel deprived from healthy sleep, and you do everything to reduce your levels of toxicity and inflammation, if you focus on all of this, you do not have to pull the trigger on whatever it was that nature had in store. You can change for your experience through perimenopause and beyond that. So how do you identify what your unique imbalances are? So you can go and get tested, as I chose to. There's a few different tests out there. I think the popular one is the Dutch test. That's what I did. And I worked with my naturopath for that. I was talking to my naturopath at the time because even with all of my knowledge, I know that I need a coach just to hold me accountable. Life gets busy, stressful. And in the beginning, because of how I was feeling and extremely quick, all at once, everything started to change for me negatively, physically and mentally. I was very demotivated. That's when I realized the importance of mindset, which is why we're dedicating a whole day to that tomorrow. So I knew I needed to be held accountable. I needed someone to help me get my mindset out of the gutter and get me right back on track, helping myself the way I know I can, the way I have many years before. When I nursed myself back from cancer in my 20s, when I nursed myself back from hormonal imbalance and postnatal depression and adrenal fatigue not long after that. So I know it works. The thing is that no matter what you know, if your mindset's just not there to support the motivation you need to get started and to stay the course, then it is a struggle. So it has to be part of your approach. Anyway, I was working with that, and so she suggested I do the testing because she knows me and she knows I just needed to see it on paper. I told her I suspected I was probably in perimenopause, estrogen dominant, but I wanted to see it. But you don't have to pay. I think it costs about $450 to get that test done. You can use the symptoms that you are currently experiencing as a key to identifying your unique situation. And I strongly recommend that you do. As frustrating and overwhelming and sometimes painful as these new symptoms can be, they are a clue to a bigger underlying issue often. Certainly when you start to see certain groups of symptoms happening all at the same time. So they are certainly the key to identifying what's going on within you. When you know what hormonal imbalances or underlying health issues you are struggling with, not you, not everybody else, but you then can get a lot more clear on what approach you need to take. You can really hone in and focus on all the right things. You just need to know what they are, and then away you go. You're off to the races. Now, remember, no two bodies are the same. Therefore, why would your approach to restore hormonal balance, heal your body from the inside out, why would your approach need to be the same as somebody else's if you have different bodies, different imbalances, and different life situations that require different strategies? So you need to know your unique situation and your unique imbalances in order to be able to customize what I call this a framework. That the framework is the foundation. Every woman should focus, in my opinion, on a holistic framework that comes at their health from all angles. But it must be something that can be customized. It can't be a one size fits all black and white box that you're in. Learn to listen to those symptoms and experiment with different strategies so that you can find what works for you. Right. So on that note, we are now going to take a look at connecting some dots for you. So I'm just checking here. I don't believe I don't believe we have anybody here live at the moment. That's okay. I'm hoping my phone is telling me what I need to know. Okay, so we are going to take a look at connecting some of the dots. So we're going to look at some very typical symptoms that you may be experiencing right now. That is probably what brought you into our group, into the Butterfly Conservatory in the first place. We're then going to talk about what likely hormonal imbalance or imbalances are at play causing it, and what body systems or body processes, things that should be happening naturally, are being affected because of this imbalance. And then we're going to take it one step further and look at, okay, so there might be an element of nature at play, like I said, fluctuating and declining estrogen progesterone is inevitable around your 40s and 50s, but what else might you be doing consciously or unconsciously from a nutrition and lifestyle perspective that is aggravating this situation, therefore making symptoms worse, or just making the symptoms happen in the first place? Without those aggravating habits, maybe you wouldn't have those symptoms at all. So let's see if we can connect some dots for you today. That's the intention, is to get you some clarity and some aha moments. So if you struggle with hot flashes and night sweats, typically the night sweats can happen earlier on, but the hot flashes tend to come later as our healthy estrogen levels are kind of on that last descent. But they certainly can happen as night sweats in the night as well. That can be a form of a hot flash or a hot flush, as some people refer to it as. But typically it is a decrease in estrogen, even if it's just a fluctuating decrease, and it may eventually come up a little bit before it totally drops. It is a decrease in estrogen. What's affected in the body when that estrogen decrease happens and we're experiencing that symptom? It's an overworked thyroid and adrenal gland, and there is less protection for your heart and your blood vessels because your estrogen levels are dropping. Remember, estrogen has a protective layer around a lot of our body systems, specifically our cardiovascular. So with less protection for the heart and the blood vessels, our blood vessels actually dilate a lot quicker, blood rushes to the surface a lot faster. So it's related to the decrease in estrogen, likely will happen anyway because we're losing that protection on the heart and the blood vessels. But if you have an overworked thyroid or an overworked adrenal gland, typically from excess stress, you are going to experience hot flashes and night sweats probably worse than somebody else. What makes hot flashes and night sweats worse? So, in other words, has a direct impact on our thyroid or adrenal gland. It's anything that's considered a stimulant. So, spicy foods, too much caffeine, alcohol, even in small amounts, unfortunately, but certainly if you're drinking too much, a high sugar diet, stress, and lack of sleep. So now you're starting to think if something, so what I want you to do with this exercise is, as we go through these, is look at the symptom and say, okay, you know what? Hot flashes is the number one thing that I want to get rid of. I can handle everything else. You don't need to. And when you take a holistic approach, all your symptoms should start to minimize. But say in the initial stages, you need to get relief from that one symptom ASAP. So focus on the fact that it is a decrease in estrogen, whether it's a temporary or a permanent, and you need to support your thyroid and your adrenal gland and your heart, essentially. So you want to focus on reducing things in your diet and your lifestyle that are essentially stimulants and things that add stress to the body. Dietary stress, obviously lack of sleep stresses is out. Spicy foods, they can be good for the metabolism, but too much of them can actually be quite stressful to the heart as well. Same with caffeine and alcohol. So let's move on to the next one. If your symptoms, the ones that are driving you crazy the most, are irregular menstrual cycles, then this is very typically the imbalance, what we just talked about. It's a sign of estrogen dominance, whether it's mild, moderate, severe, temporary, or a permanent situation as you're going through perimenopause. It is the imbalance between the two. So what's affected? Obviously, you are likely more prone or at risk or already have the condition of estrogen dominance that you need to manage. And your immune function is going to start to suffer a little bit as well when you are estrogen dominant, because it is very stressful to the body. Anytime our body's overstressed, our immune function is depressed. What's adding to the load? A high fat diet, excessive caffeine and alcohol, and a lack of exercise. All of these things can help to minimize toxic estrogen, so shrink the gap by bringing estrogen levels a little closer to progesterone. Again, that's where the exercise comes in. And then obviously high fat diets and those stimulants again. You want to minimize those. Mood swings and irritability. So what's the likely hormonal imbalance? Fluctuations in estrogen, progesterone, and your serotonin. So serotonin will be affected hands down when estrogen starts to decline. But if your thyroid or your adrenal gland are overstressed and overworked, that is also going to be a factor, and poor immune function. What habits aggravate these symptoms? High sugar intake, caffeine, processed foods, lack of sleep, and stress. You're going to see differences between them because there are specific things that obviously have much more of an impact on a certain body system or a certain process. But I think what you're going to see as we go through these charts, these symptoms, is that a lot of them intertwine. The same things start to come up in certain situations. Okay, so weight gain, especially around the midsection. So this is one that we've all probably noticed, even if it's nothing that is something we really want to get a grip on right away. Maybe, we're one of the lucky ones and it's not our prime concern. Either way, it is typically something we do start to see. Even if we manage to keep a fairly slim figure, some women find that their cellulite starts to come out of nowhere. And that's a result of these hormonal imbalances too. So typically a result of changes in estrogen, which obviously affect cortisol levels and our insulin levels. All of these three have a direct impact on how we manage our weight and our metabolism. It can leave us with increased insulin sensitivity, inability to metabolize glucose. So we store it as fat instead of burning the fat, and therefore it affects our metabolism. So a sedentary lifestyle, high carb diets, high sugar diets, and again, there's that dreaded word, stress, are adding to the load. Fatigue and lack of energy. So low thyroid hormone, low estrogen, and an imbalance in cortisol. These are likely the imbalances at play here. Again, your thyroid and your adrenal gland are clearly overworked if this is the case, and your metabolism is slowing. So look at your diet, lack of exercise, insufficient sleep, and high stress lifestyle as factors that are making it worse. So sleep disturbances, whether that's constant waking, struggling to fall asleep, or insomnia in some cases. So when our progesterone levels naturally decline, this typically happens anyway. Certainly, so that to initially, without doing anything else to improve the situation, you will find that you're sometimes fighting a losing battle with sleep as progesterone declines. It will affect the change in these hormones will affect your melatonin levels. And as I mentioned earlier, melatonin is what helps you to fall asleep, stay asleep, and ideally your melatonin levels should drop when it's time to wake up and it's light outside. So a poor immune function, overworked thyroid, adrenal gland will all contribute to sleep disturbances. And if we're having too much caffeine, especially in the latter part of the day, or having too much screen time, obviously before bed, blue light devices, they're also going to impact your sleep. So this right column, if you haven't figured it out by now, is the areas where you have the control, right? The second column, some of the hormonal imbalances are natural and others are a result of our habits, and therefore we even have some control over them too. What about a reduced libido? So a reduced libido is something that you are struggling with. Well, definitely a decrease in testosterone and also estrogen are the likely imbalances happening here. You also, as a result of the decrease in these hormones, are going to have less protection for your heart and your blood vessels, which, if you think about it, your blood vessels, that rush of blood through your blood vessels is what helps a man have an erection. It's also what helps us feel our libido. Estrogen dominance will also dampen your libido as well. So being aware of, a toxic lifestyle that might be contributing to toxic estrogen and increasing your estrogen levels, the bad estrogen. So poor diet, lack of physical activity, alcohol is a big one here, stress and lack of sleep. Brain fog and memory lapses. So low estrogen can affect cognitive function 100%. So again, there's an element of nature there. When our estrogen drops, our immune function does get a hit, and our thyroid and adrenal glands kind of pick up the slack of the work that the ovaries were doing to try and produce estrogen. So that's why we often experience the brain fog and the memory lapses. In addition to the fact, what I didn't put in here is it also has an impact on your gut. And we talk a lot about gut in my program, and it's something that always comes up with clients. And we'll talk about it more later in this challenge. So high sugar diets, lack of omega-3 fatty acids can make brain fog and memory lapses worse. And it is actually a very, very important deficiency that most women do have simply because we don't get enough of them naturally in our diet. Dehydration and lack of sleep can also make this worse. So they're lifestyle habits that we can control. If your skin is extremely dry and your hair is falling out, yes, low estrogen, and that impact of that can be on your thyroid hormone. That will certainly play into those symptoms. Your body will be affected with a slower metabolism and poor immune function. What habits are making the natural hormonal imbalance worse? Being dehydrated, lack again of essential fatty acids in your diet, and excessive caffeine. A couple more here. So changing taste buds. So this is one, again, that I said a lot of. It's not talked about as often, but it is actually quite common. And this can be because of fluctuations in estrogen. So as estrogen levels fluctuate, that's why the tastes change. When you get a sour taste in your mouth or a bad taste in your mouth, that can be for a couple of reasons. But remember, estrogen has that protection factor about it. So as estrogen levels drop, we are more prone to bacteria. Um, and so what happens is we can end up harboring bacteria in our mouths easier than we used to do before. So that's part of it. But also gut imbalances happen as a result of the fluctuating hormones, causing poor digestion and liver function. And anything that's going on in the gut that's not good, it does tend to affect certainly our taste, our taste buds, but also our breath as well. People that have major gut imbalances typically have halitosis. They have bad breath because it's the fumes essentially coming up from the food that's not having a chance to fully digest down there. What is contributing to changing taste buds that you can minimize and control? Highly processed, spicy foods and excessive alcohol consumption. These all play a part in how sharp your taste buds are and keeping bacteria under control. If your extremities are tingling, so again, this is fluctuations in estrogen, which can actually affect nerve function. Remember, one of the protective benefits of estrogen is it helps to keep the myelin sheath that surrounds all of our nerves. It keeps that in place, keeps them strong, those myelin sheaths. So when we start to lose estrogen, we can have nerve function issues, like our nerves are a little more exposed. So along with that is going to be less protection for our bones, and our immune system is a little depressed. If you're having excess caffeine, a high sugar diet, or you're dehydrated, that it can make these symptoms worse because it's affecting those body systems. Electric shock sensations is very similar. So it's the fluctuations in estrogen that lead to changes in the nervous system. And that's typically not just less protection for our bones as our estrogen's decreasing, but also an overworked thyroid and adrenal gland. So high stress, caffeine, lack of B vitamins, certainly in your diet, although sometimes supplementation could be, you might need supplementation and you just aren't doing it at that specific time, or poor hydration. All of these things will make the situation worse. And last but not least, I wanted to go through the most common ones because I'm sure at least a few of these are going to stand out to many of you. So gum problems and sensitive teeth. So when this happens, it's likely a result of a decrease in estrogen because it does affect oral health. Again, it's that protective nature of estrogen that we're losing to control bacteria. So we do tend to have more gum problems. Gut imbalances cause poor digestion and liver function and that can be that is a symptom of this. Habits, poor dental hygiene, sugary and acidic foods, and a lack of vitamin C can all contribute more to this problem and to gut imbalances and poor liver function. The burning mouth syndrome, actually, we kind of touched on this, but it is an actual syndrome that a lot of women do mention. They describe it, they just don't necessarily know it has a name. But again, it's a result of a decrease in estrogen, which affects the mucous membranes inside your mouth. So they do become more sensitive and gut imbalances causing poor digestion, liver function, less protection for the bones. Again, all body systems that are affected with these hormonal imbalances. What are we doing to make them worse? Spicy acidic foods, lack of hydration, and probably too much alcohol, or some cases, even alcohol in general. Digestive changes like gas and bloating, very, very common, and they tend to get worse as our estrogen fluctuates because it does have a direct impact on our gastrointestinal tract. So we do experience gut imbalances. It's pretty much a given at some point when the hormones do start to shift, but we also are making our gut imbalances worse by eating those processed foods, the high saturated fat foods, not the healthy fats. We may not be getting enough fiber, so therefore our bowel movements are not regularly enough to help us detoxify everything in our body that needs detoxifying. Toxic estrogen, undigested food, proteins, um, bacteria, viruses, parasites, you name it. We should be getting it out regularly. When we can't go to the bathroom regularly enough, we end up reabsorbing toxins into the bloodstream and we can feel rough all over again. Oh, I do have three more. Muscle tension and aches, buzzing in the ears, and changes in body odor. So again, you know how this works by now. You can see what the likely hormone imbalances are here that can cause these symptoms. Some are from a nature source. Some are from a nurture source. That's essentially the point that I'm trying to make here, is that despite the fact that there may be fluctuating estrogen and progesterone, which is a part of nature, there are often other hormonal imbalances that are affecting your body processes, affecting your body systems, organs, and glands, and they're causing these symptoms. And the reason that the other imbalances might be happening is not just because estrogen and progesterone are having a direct impact on them. It's your nutrition and lifestyle habits that are making the symptoms worse. So what we need to focus on is minimizing, fixing those aggravating habits in the right-hand column. When we do that, we can have more control over what's happening in the second column. So despite the fact that estrogen and progesterone will continue to do the midlife dance, high cortisol, low thyroid hormone, excess um, uh, imbalances in your appetite hormones. All of those things, they will be a lot more manageable if you can handle everything that's on the right-hand side. And then the affected body system and processes will start to find their natural balance again when they're not overloaded. So hopefully by now that's given you an opportunity to see how your symptoms and knowing what they are can help you to identify a lot of what's going on inside you, not just the hormonal imbalances, but the underlying imbalance within your body overall and what you may be doing without realizing it to make those symptoms worse. So how do we address it? We need to come at addressing the underlying health issues from a holistic perspective, which is what I've said all along. We need to concentrate on our mindset to help us stay in the right place, not only to start making the changes, breaking the old habits, creating the new habits, and helping us to stay the course, but also to make sure that it's kind of it's like a cycle. It's like a cycle. If our mindset is in a very negative place, it actually depresses. It has an impact on other hormones. Just that the low mood will then impact on your stress levels, which then impacts on your adrenal glands, which then impacts on how well you can manage insulin and your ability to burn fat and your metabolism and your energy levels. See, it's all connected. It has to be addressed holistically. So why? Because you need balance. Nutrition, we focus on nutrition because it's going to provide building blocks for all your hormones. Hormones are made from vitamins, minerals, proteins, healthy fats. All of our nutrients that we consume help to build hormones. If we are not taking in healthy building blocks, how can we expect our to be making sufficient quantities and high quality hormones for them to work and do their job properly? So nutrition absolutely has to be part of the solution. Mindset, as I said, ensures those emotional, psychological well-being issues are being addressed because they will have an impact on each other when it comes to regulating hormones. And your lifestyle choices, not only will they help you to sustain a daily routine if you can get into healthy lifestyle habits, but again, so many of our habits are actually adding toxins to our world, to our body, and we don't even know it. Some are more obvious than others, and we'll talk more about that as we move through the challenge. We need to address hormonal balance through holistically because we need to take a personalized approach. Remember, everyone's midlife journey is going to be unique. We can't just say you all have to do this. You all have to make these nutrition changes and everything will be fine because you may have a mindset issue that somebody else doesn't. You may have a specific lifestyle that makes it difficult to be able to minimize your exposure to certain toxins. We need to ensure that by coming at it from a holistic perspective, we've got plenty of opportunities to address your individual needs and break through your individual challenges. And then last but not least, for your long-term health, when we come at solving a problem from a holistic approach, it allows us to be more consistent and to create habits that we can sustain for the long time because each one of these three pillars supports the other. If you're just using one of those pillars to try and fix all of your imbalances and health issues, you're going to trip up. You can have all the nutrition knowledge in the world. I am living proof of that. You can have all the nutrition knowledge in the world, know exactly what to do, what to eat, how to eat it, stay on track. But if your mindset is in the gutter, it's in a place of negativity, you're struggling with your own self-worth, your self-confidence because of watching your body change into something you don't recognize, it's not going to be long until you give up on those nutrition habits. Your motivation just will not be there. Same thing if you have the best mindset in the world. You are a go-getter, you're a positive thinker, you're determined to do everything there is to know. You even know what to do from a nutrition perspective. But what you don't realize is how you're exercising in your lifestyle, one of your lifestyle habits is actually adding stress to your body and causing more harm to your hormones than good. That's just an example. You have to look at all three pillars and treat your body from a holistic perspective. So how do we do that? This is essentially the holistic blueprint to hormone harmony. We're going to break it down a little further for you here as we end today. So mindset, what's involved in mindset? What do you have to consider when you say that you're doing mindset work so that you are kind of covering off that pillar? Well, it comes into play if you are an emotional eater, or even if you don't classify yourself as a regular emotional eater, someone that's struggled with it for years. A lot of women start to experience episodes of emotional eating as they're going through perimenopause because the stress of it all and all the wacky changes that seem quite overwhelming at times can lead them to end up eating for comfort rather than for hunger. So your mindset has so much to do with whether or not you can control emotional eating. It's not just about knowing what to eat and when to eat, But if you find sometimes that cravings and the desire to eat all the wrong things is so out of your control that it throws you off any weight management, weight loss goals that you have for yourself, then mindset is a huge part of that. It's not all, but it is a huge part. So mindset comes into play for that. It comes into play when we need to manage limiting beliefs. We'll talk a lot about this tomorrow, so I'm not going to go into it in detail now. Just know that there are subconscious beliefs that we all have. Some of them stem back to our childhood that unknowingly are holding us back from either making change or getting to a certain point and then thinking that it's not worth it or we're not worthy. We need to manage those beliefs. We need to smash through them and replace them with beliefs that are going to move you ahead in life. Managing self-worth, negative self-talk. We do this more and more as we start to see our bodies changing and we start to lose our confidence, even if you never did it before. So mindset is key for getting on top of all of that. Mindset helps you to overcome roadblocks. You're going to have challenges. Stress happens. We can't say we're never going to experience stress again in our life. So if you can overcome those roadblocks, you need to overcome those roadblocks to be able to continue and stay the course with your habits. And there are going to be days when you're going to be very determined to throw in the towel. You're going to look for excuses. You're not even going to need to look that hard. That's where your mindset comes in. You got to keep reminding yourself why you're doing what you're doing and what's at stake if you don't. It helps you to be consistent for the long term. As I said, if you manage to finally get some momentum going and you are doing all the right things from a nutrition and a lifestyle perspective, when those bad days come or those big life events come and throw you off of your regime, it's mindset that will get you back on to that horse. From a nutrition perspective, we need to look at balancing our blood sugar levels. We need to rebalance our gut and make sure that our gut environment is able to fully digest quickly and effectively all of our food so that we have plenty of nutrition to absorb into our bloodstream for the liver to then work with, because our liver regulates all levels of nutrients, it regulates your blood cholesterol levels, all the levels of hormones in your blood. And in addition, it is your detoxifier, right? It's responsible for breaking down the garbage that ends up in your body so that it can be flushed out. So we need to make sure that we are supporting the gut and supporting the liver so that those jobs can be done effectively. We are always looking at reducing inflammation. You have to focus on reducing inflammation. And we'll talk a lot more about that on Friday when we dive into how we can do that, what we need to focus on. And at the same time, you need to be eating in a way that is supporting your body's stress response. You're not adding stressors to the body. You need to be supporting your adrenal and your thyroid. Remember, they are responsible together, hand in hand, for so many important body processes that when they're not working well, lead to the majority of the symptoms that you're experiencing. And then last but not least is lifestyle. So within the lifestyle component, the lifestyle pillar, we're looking at things like exercise. As I said, how are you exercising? Are you exercising at all? First of all, maybe you can't because you have restricted mobility. And if so, that's the case. That's fine. That happens. We have to come um, at a place that works for you. This is what I mean about customization. So there is daily movement practices that you can do that are something potentially that you can fit into your day and it works with your limitations. So we not only need to make sure that you are factoring some sort of daily movement or exercise, but are you doing it in a way that is supporting hormone balance? Or are you doing it the way you did when you were younger, before your hormones started to fluctuate and wreak havoc, and you're actually making the situation worse? We look at detoxification of your lifestyle, all the things that are knowingly or unknowingly showing up in your life that are contributing to your toxic load and therefore increasing inflammation, leading to estrogen dominance, and putting your health at risk at way bigger levels than the symptoms that you're experiencing on the surface. Sleep and stress management, hands down, obviously, these two parts are so, so important, and something that we always need to be focusing on how we can improve, how we can support our hormones to improve our sleep and improve our ability to manage stress more quickly and more effectively. And also, we want to make sure that we are balancing our life, our quality of life. So once, it's not all about your health. In order to fully enjoy your perimenopause, menopause, and postmenopause years, yes, we need to get your health into the best state it's ever been in, which is very achievable, by the way. Age has nothing to do with it. But we need to make sure our quality of life is not suffering. So we need to look at the balance between our work and our life and our joy and how much joy we actually have in our lives, whether we feel fulfilled. Have we discovered our purpose? Do we know what our purpose is? Maybe we want to find out. All of these things factor into lifestyle, and they affect your mindset. Your nutrition affects your mindset, vice versa. See how they all cross. It's a trifecta that we have to address. So lots of information there, but again, you have the replay so you can go back and you can go through it at your own pace, stop, fast forward, rewind as you need to. Just want to touch on your pre-work before we finish today. So your pre-work was ideally something that when you downloaded your challenge workbook, you had a chance to look through. It's a reflection exercise. The key being, I want you to really commit to understanding what's going on in your current situation. The more you understand what's going on, and hopefully today's session has really helped you to dig deep into that. But in general, you may have already started to answer these questions based on where you were even before you saw this session, and that's great. That's exactly what I wanted you to do. If you haven't, then take this new knowledge and take a look at these clarity exercises and take a look at the questions. Try and write down, what are your main challenges right now? What do you believe they're having? What impact are they having on your health? Are you seeing recurring patterns that continue to derail you? You might now, after watching this, start to be able to compartmentalize if they're in one of the three pillars. That is also going to help you focus on where to go from here on. What limiting beliefs do you think you have? Start thinking about it, but we'll dive into that a lot more tomorrow. Clarity exercise number 2 is to then think about your future. So you've already kind of reflected on where you are currently, but where do you want your future to look? When we envision our future, it excites us. It makes us believe that anything is possible. Certainly, as we work through crashing those limiting beliefs that you may have and giving you clarity on just how much power and control you do have over your health, you really then start to see what's possible for your future. So these are just some questions to start to get those juices flowing. So if you haven't already had a chance to do that, then by all means, take a look at that after this session and see if what you've learned today helps. Focusing on your current state of health, think a little deeper. What are the top 3 to 5 health concerns or symptoms that you want to get relief from right now? So maybe it was one of the ones that we've talked about. It might be something different, but get clear on what exactly it is. It'll give you a focus as to where you want to start. Remember, overall, you need to be addressing the big picture. There's a long-term approach to addressing your health underlying imbalances overall. But that doesn't mean that there aren't short-term things that you can do specifically to help you with certain symptoms or in certain areas of struggle to help, because that is in itself is going to then motivate you. If you feel slightly better because one symptom or two symptoms have been able to be improved, it's just going to motivate you to keep going, imagining what else could be possible if you actually address all those underlying imbalances from the root cause. So think about that. Maybe now you've actually started to identify what underlying health issues might be causing some of your symptoms. What support or resources do you feel at this point you would need to achieve results? And that is simply something that I would love to hear your feedback on. It's an eye opener for you. You need to know where you have blockages. Maybe you need one-on-one support. Maybe you just need some resources. You need more time. You need support from others. Again, think about what it is that is maybe maybe cause you to struggle to get results to this point, and think about what could help you to break through. What strategies have you tried before only to not achieve the results you desire? And it's important that you recognize those so that you're not distracted by them again. So lastly, your homework. So I know everybody hates that word, but hopefully when we're talking about personal development, personal growth, and health improvement, you don't see it as homework. You see it as work that you are excited to do. I don't even want to call it work. So what I would like you to do is, I said, have a look at the pre-work if you haven't already done it. Complete your day one homework is just a couple of questions in the day one section of the workbook. So work through them based on what you've learned today, and that'll just help to kind of embed the learning and hopefully put it all into perspective. And then if you haven't already downloaded the 2 resources that apply to today, then please go do so. The links are inside the workbook. Complete your hormone imbalance and root cause symptom assessment, and you can solely do this for you. It's for your own benefit. However, if you would like my input, if you would like me to have a look at your assessment results, then I'm happy to have you submit it. And you have the ability when you open it, it's a Google form to submit it, or you can just fill it out. You don't need to hit the submit button and use it for your own knowledge, because with the knowledge that you have gained today, tonight, you might just find that it's really helpful now for you to start to identify the patterns yourself, and you don't need me to tell you what they are. I'll leave that up to you, but I'm here if you'd like me to have a look over your shoulder and see, give you my feedback. And then you have your habit tracker. So if there's one thing I would like you to absolutely start to do as soon as possible, it's take a look at that habit tracker, work your way through it, and how it's set up is you have a list of habits that ideally you need to break. And it is purposely set up, that list, to include the worst habits that can throw you off of any type of health improvement routine. Then there is a list of healthy habits that ideally you want to make as many of them and embed them into your life, because they are the ones that are going to shift you forward, help you to stay consistent and start to see real change. So the habit tracker, it's set up to give you 12 weeks of guided prompts. You don't have to use it for 12 weeks if you think you're getting a grip on it. You can use it for longer. In fact, I recommend people do it on a regular basis, because we always pick up weird and wonderful habits, and some are just harder to break. But the intention of the tracker is to help you become more self-aware of what it is that you are doing, the areas that you have control in nutrition, in lifestyle, and mindset, the 3 pillars that are potentially holding you back, making your symptoms worse, not helping any underlying health issues that you have, in fact, could be making them worse. So we want you to work through, be honest with the tracker. It's for your benefit only, and start noting all of those habits that you need to break, and start noting when you create new ones. Over time, the intention is you'll see a lot more new habits and a lot less bad ones on that list that you check off. Any questions at all about the resources or the homework or the content from tonight, please let me know. Let me know in the Facebook group, post comments in there. You can put a reach out to me on direct messenger if you wish. I would love to know your feedback and your questions. If there's any questions that I can help clarify before day 2, that's a bonus, because I want you to be as clear about what we're doing and why we're doing it as you possibly can. So there you go. Tomorrow, day 2, we're really going to be digging into mindset, breaking some limiting beliefs, and talking about how you can support yourself and improve your confidence and your self-worth. And that is an important part that we will address tomorrow. So I will be back in here in the group 6 o'clock Eastern. And until then, enjoy the rest of your evening, guys. And we'll talk to you soon. Bye for now.